Hello everyone, my name is Maria Camila Rivera Serna and I am going to present FastestER, a web application to enable effective emergency department service. The co-author of this paper is Professor Subrata Acharya from Towson University. The purpose of this project was the development of a web application to allow users to find the emergency room that provides the best, timely, and effective care. The user will provide as input his or her current zip code with limit distance in miles to be able to travel. Results will display the basic information of the emergency departments found that match the search criteria. Also, the estimated travel time and the timely and effective care index. That is a quality indicator created as a part of this project that will help the users to determine which emergency department offers the best service. Due to budget constraints, the current application is a model that works only for the states of Maryland, Virginia, and DC, but can be easily extended for coverage of all states. In order to understand better what was the motivation of this project, it is important to know that overcrowding in emergency rooms is a worldwide problem that affects the ability of hospitals to offer emergency care in a reasonable time frame. Long waiting times delay every stage of the visit, from initial diagnosis and treatment to final decision-making to admission or discharge. Also, the risk of death and hospital readmission increase with the degree of crowding in the emergency department, and for some patients the frustration with long wait times is so long that in 10% of the cases they leave without being seen. The wait time at the emergency room depends on many factors, including the acuity of the patient, the available resources, and the day and time when the patient arrives to the emergency room. To determine the order in which the patients that arrive to they use an emergency severity index, which is a 5-level emergency department triage algorithm. It tells you how long a person can safely wait for medical treatment. So, when a person arrives to the emergency department, a healthcare professional determines if the patient requires immediate life-saving intervention. If so, the patient will be assigned to a triage level 1. Otherwise, it has to be determined if the person is confused, disoriented, lethargic, or in severe pain or distress. If this is the case, it will be assigned to a triage level 2. Otherwise, depending on how many resources the patient will require, it will be assigned to a level 3, 4, or 5. Now, after having a background of the problematic, I will continue discussing the methodology used for the development of this project. Development was carried out in 4 different phases. The first phase was data selection. The second was algorithm selection to calculate the timely and effective care index. The third phase was web application design. And finally, the functionalities implementation was the 4th phase. So, for phase 1, we obtained the data from data.medicare.gov. We used the hospital compare datasets that are officially used on the medicare.gov hospital compare website provided by the Centers of Medicare and Medicaid Services. This data allows to compare the quality of care at over 4,000 Medicare certified hospitals across the country. The original dataset contained all kinds of quality measures of the hospitals. From this original set, only 5 quality measures that were directly related to timely and effective care were selected. The first selected measure was the average time patients spent in the emergency department before they were seen by a healthcare professional. The second one is the average time patients spent in the emergency department before they were admitted to the hospital as an inpatient. The third is the average time patients spend in the emergency department before being sent home. The fourth measure is the emergency department volume. And finally, the fifth measure chosen was the percentage of patients who left the emergency department before they were seen by a healthcare provider. To determine the timely and effective care index, scores were assigned to every emergency room according to the 5 properties chosen as follows. For the only qualitative property, that is the emergency department sign as shown. If the emergency department volume was very high, which is a not desired feature, the emergency room will receive the lowest score for this property, that is 25. On the other hand, if the emergency department volume is low, the highest score, that is 100, will be received. For the quantitative properties, the data of each one was divided using percentiles. In total were 5 percentiles. A score for each property was assigned to every emergency room according to the percentile that the data was placed. Once we had a score for every property, we calculate the average score between these 5 properties to assign a final score, which we call the timely and effective care index. This index will provide the patients the information required to select the emergency room that offers the best service. With the data and algorithm selected, we move to the third phase of the project, that was the web application design, which is simple and user-friendly. The application consists of 2 views. The homepage, where the patient will input the current location, zip code, and the maximum radius that will be able to travel to an emergency department. And the result view, which will display the list of the hospitals found in the area delimited by the user. Each output have the information of the emergency department, including the name, the address, the timely and effective care score, and the travel time. The tools used for the development of this project were, for the front end, HTML, CSS, and JavaScript. For the back end, we use Express Framework, Node.js, and for the database, we use MongoDB. The APIs used were Zipcode's API and Here API. The IDE where the project was developed was Cloud9. Some of the libraries and packages used for this project were EGS, PolyParser, Request, and Bootstrap 3. Here you can observe the data model of the database. The latitude and longitude for each emergency room were obtained from the API request using the address posed in the original dataset. The partial score attribute corresponds to the timely and effective care index that was calculated with the described algorithm. The final phase was the functionalities development. This was accomplished with 2 GET requests. This flowchart summarizes the first one. It shows the steps followed to obtain the geocoordinates of every emergency room, using the address from the original dataset. After obtaining the geocoordinates, they were added to the data model and saved in the database. The second flowchart shows how the output of every request made by the user is obtained. First, coordinates of zip code given by the user is obtained from the API. Then, the indicated by the user are obtained from the same API and saved in an array. Then, the list of hospitals in the database that match any zip code in that array is retrieved. The travel time to every emergency room in the list is obtained by providing the geocoordinates and making the request to a different API. The final output consists of a list of emergency departments in the delimited area given by the user, and each emergency room have the corresponding address, expected travel time from the current location, and timely and effective care index associated. The results of this project are a completely functional application. Here we can see the homepage with the respective fields where the user will input the search criteria. That is the current zip code and maximum radius in miles. Below is the link to the website. We encourage people to try it, having in mind that at the moment, the only zip codes valid are from Maryland, Virginia, and DC. Here is an example of a user search. The user provides a zip code of radius 10 miles as an input. The output displays a list of 9 emergency rooms in the area with the respective information. From these results, we can see that Suburban Hospital is the closest one with 12 minutes of travel time. but the timely and effective care index is 62 over 100, while the second closest emergency department is Adventist Healthcare Cherry Grove Medical Center with travel time of 14 minutes. This is only 2 additional minutes of travel time regarding the first option, but with a timely and effective care index of 75 over 100. In this case, the user, depending on the circumstances, can choose to go to the closest emergency department or the one with the best quality care service. From the analysis of the results provided by the application, it can be established that the application works properly and gives accurate results. The timely and effective care index will help the users to find an emergency department that can provide them appropriate treatment in less time. A further study will be necessary to prove the usability of this application and the satisfaction of the users with the results. There are other applications that give patients an estimated wait time at the emergency room. This average emergency room wait time used is the time patients spend in the emergency department before they were seen by a healthcare professional. This is only one of the 5 parameters used to calculate the timely and effective care index in this project. This healthcare professional could be a nurse, a health practitioner, or a doctor, and does not represent the beginning of treatment. This first contact with the healthcare professional could be only for the purpose to fill a registration form. For this reason, the solely measure is not enough to give the patient an accurate idea of the quality and timely service expected at certain emergency department. To improve the application and to determine its usability and user satisfaction. One of the improvements planned is to implement a search system using the current location of the user through global Wi-Fi and cell coverage. Also, more functionalities could be added, like displaying maps with positions or provide routing. Finally, in order to know the effectiveness of the application, beta testing should be carried out. Thank you so much for your attention.